This video is going to be all about children who are either problem feeders or picky eaters, and the things you can do if your child is in either category. This video is based on the principles in the SOS approach to feeding training. The training for parents is free online, but is 2 hours long, so this is a condensed version addressing the key points. But for more information, please do visit the website address on screen now. So let's consider what the difference is between a picky eater and a problem feeder. So a picky eater will have a decreased range of varieties of foods, but they will eat 30 plus foods. Foods that are lost due to burnout, which means they're eaten too often, will be regained, but after 2 weeks. They will tolerate, touch, and taste new foods. They eat at least one food from each nutrition and texture group. A problem feeder eats less than 20 foods. If foods are lost due to burnout, they will not be reacquired. Children will cry and have a meltdown when a new food is introduced, and they will refuse entire categories of food, textures, and nutrition groups. It is so easy as parents to blame ourselves, but research shows that it is not the parents' fault. In only 5 to 10% of cases is it parental influences that is the cause for eating problems. Skill deficits and physical problems are most commonly the cause of feeding difficulties. The family mealtime, structure, routine, and schedule is an influential factor. A parent's ability to be a role model for their child is so important, and how we engage with our children and discuss food with them. So a myth. Eating is the body's number one priority. This is not true. Breathing is our number one priority, and postural stability is our second priority. The best way to ensure that your child is not preoccupied trying to achieve postural stability would be to have them seated in a 90-90-90 position. This is the most stable position for your child to eat in, and therefore allows focus to be returned to eating. For some of the pre-made chairs, they can be really expensive. So you can just add yoga blocks or anything you have lying around, as long as it's safe, to a chair you already own. This can be a much more cost-effective way of doing things. You may consider there to be a couple of steps to eating. Maybe seeing a food, smelling a food, then eating a food. This is not true. There are so many more steps to introducing a food to a child. On average, it takes 20 steps to eat a new food. For someone with ASD, this would increase to 40 to 60 steps. And for someone who is a problem or picky eater, this is on average 32 steps. So, if your child is visually tolerating a food on their plate or even on the same table as them, you are one step closer to introducing a new food the next time you introduce it. If your child is not ready to directly interact with a food or try a new food, having food on their learning plate means they're looking at it, potentially touching it, then throwing it in the bin. This makes them a lot more ahead than if they hadn't used their training plate. Structure is really important. It's important to structure both meal times and snack times. It's important to ensure your child is at the same place on the same table, and ensure that you use a placemat to use as a cue to symbolise a meal time. Make sure your child has at least one of their preferred foods on their plate every meal and snack time, and make sure you stick to the same schedule. Here is an example for a routine for meal times. Step 1. Issue a warning. For example, 5 minutes until dinner time. Step 2. Have a transition. So this is a bridge activity between what they were doing before and their meal time. So for example, it's time to wash your hands, ready for dinner. Step 3. Set up the table with an empty plate. Step 4. Have family style serving. So everyone gets a part of each food, and you can use the learning plate if this is needed. Step 5, clear up. Encourage your child to throw away the food. Remember, this is still one step closer to eating a new food. So here's some tips. Firstly, present only 3 foods at one time so the plate does not become too visually overwhelming. Tip 2, present the food in manageable bites for your child's skill level. And do not anticipate that skill level will be congruent with chronological age. This is different for every child. So now we're going to go through some steps. So some general tips throughout the steps is just to make sure that you have general positive talk around meal times. Try to engage your child in age-appropriate games and just make it an overall more positive experience. So here are step-by-step guides to food acceptance. Step 1. Choose a new food and put a tiny amount on your child's plate. If this causes upset, use the learning plate. Put the new food in the same place on the same plate each time, ensuring that it is not touching already accepted foods. Step 2. Get your child to smell the food on the plate. You can get involved and smell the food also. Remember that you are a teacher and a role model in this behaviour. Step 3, encourage your child to pick up the food on a spoon or a fork. It's completely normal if your child does still not want to eat the food at this stage. Step 4, encourage your child to pick up the food with their fingers. Step 5, encourage the child to touch the food to their face and then to their lips. Try asking them to kiss the food and then try touching it to their tongue. Allow your child to do this at their own pace. For some children, this may happen all in one mealtime. For others, it may take several. Then encourage your child to lick the new food and put the food in their mouth. At this stage, your child does not need to swallow the food or chew the food. Stage 7, encourage your child to bite and chew a very small amount of the food. Stage 8, gradually and over time increase the portion size, ensuring that you never give your child more than a normal portion size. And congratulations, you have introduced a new food. Remember, this is a cycle and the same steps should be taken each time you want to introduce a new food. We really hope this video has given some useful and practical tips to help. If you're still concerned, please either watch the extended version of the training on the SOS Approach to Feeding website, contact your GP or health visitor with feeding issues, and it is really helpful to have early intervention, so do not dismiss any concerns. Please do talk to someone.